care or anything. This is not what this is about. But I have to highlight the fact, because I would be wrong not to, I have to highlight the fact that you can get better care if you go down this route to this model of care. And the final thing I would say, it's not only Windsor and Maidenhead that doesn't have an acute hospital, neither does my entire constituency. Okay, which is, considering the fact it was a new town, it was promised a hospital when it was started in 1960, it doesn't have one. And I have been brave enough to say to my community and to my constituency before the election that they would never get a hospital in their constituency because of all the information that I've shared with you this evening.
Can I just say something else that I think will be changing in the next few years? It's not to do with A&E, but I had a day operation last week in Heatherwood.
Yes.
That actually had to be done because Wexham hadn't done it properly.
Yes.
Previous time. But you have to have somebody with you when you come out of daycare.
Yes.
We've got a growing population of single people that don't have families living near them. I think going maybe 10, 15 years down the line, it's going to be harder and harder to do day operations on people and get them to have people with them.
That's a fair point, but that's a comment about society which I'd love to develop now, but I can't. The final thing I would say is that 80%, over 80% of the work done at Heatherwood is on patients in Slough. This is madness, utter madness.
Should we take the lady here who identified you, and then the lady there, and then I think we may draw it to a close.
Just one final point on the location, because of availability of a particular plot of land. That plot has no scope for extension. Sorry, the land that has been identified initially for this hospital is actually on a triangle of roads with no scope for expansion. Whilst we can support the theory, you should pick somewhere where you can expand, because that particular site that's been offered, you've got the M4, you've got the access to the M4, and you've got a major trunk road. There's nowhere else to expand. And you might find that if you need a helipad, you need more and more car parking, you need staff accommodation, you need a site that's got land beyond it that you can spread to. So whilst near junction 8-9, look further up the motorway maybe, with some slip road somewhere, maybe closer to the Bracknell thing, where there are fields beyond that you can expand into.
I mean, I'm not, as I said, I'm not fixated, and as I made clear, I didn't say there is a piece of land, let's build a hospital there. I chose a location. The piece of land then came to my knowledge, and then I had people coming to me about it. That was the way round that it worked. This was more about choosing a transport location, not an actual physical field. It was saying
you get local support if you choose a good location.
The lady there.
I was just wondering if there was maternity in your head for acute. Does that
sure.
come under?
Well, that's an important question actually on maternity services. Another thing that I've done, which I'm told is not necessarily normal for a politician, is to call for my maternity unit not to reopen at Heatherwood. And I did that because I'm not a supporter, particularly of midwifery-led units. The data comparing midwifery-led units to consultant-led units, I encourage you to go and check that on Google. And it's also a unit that was delivering less than one baby a day, which begs the question, who on earth sanctioned it in the first place? The reason that it has temporarily closed, I think, is it's where it is at the moment, is because essentially lots of babies are being born by new communities in Slough, and the obstetric services in Wexham are struggling. And so that's the reality as to why it's happened. But I think it is an example. Maternity services is a classic example. The interesting thing to me in Northumberland, the people who came to see me from Northumberland, the main driver of that plan over 14 years was a local obstetrician. And I gather that there are similar issues in Hampshire with regards to the merger of the trust between Basingstoke and Winchester, and obstetrics are wanting one site. It is another reason for why you want one site. Because I know if I can ever get round to finding somebody who wants to have my children, madam, she will be delivering in a consultant-led unit. And if that's what I think, then why would I want less for my constituents? That wouldn't be right. And so maternity services is a classic example of something where a consolidated site, I think, is in the best interest of everyone.
Thank you very much, everybody. I said earlier, thank you all for coming tonight. We've had... Sorry,
Could I just interrupt just for a second? The lady and gentleman who came in late made a very, very good point, because the essence of all this is communication, communication, communication. Without it, it's not going to get off the ground. So could I suggest that you look seriously into creating or starting to create this Friends of the Royal Thames Valley Hospital, no matter where it's built, so that a database can be consolidated, and then any meetings, changes, information can be sent out to people via the internet. I mean, we do it to over 5,000 people in Buckinghamshire. So I'm quite sure if we can do it, as old age pensioners, that you can do it. And I would suggest strongly that you start it off now.
Thank you very much for that suggestion, Terry. And you're right in that, I mean, the purpose of holding the public meetings is to get a feel for people's, and to encourage people to think about this idea, because it is important that there is local support. If this is going to take place, it needs to have that local support. So thank you for coming tonight. A number of issues have been raised. Obviously, Philip, as he said, has got some more public meetings in other parts of the Berkshire area that he will be holding, and then obviously we'll be considering how to take this forward, and obviously I want to be talking to him about that when the time comes. But can we all say a huge thank you to Philip, not just for coming here this evening, but actually for the work that he has done to put this idea together, and to start us thinking about what is the right hospital provision for us here. Because, as he said in the beginning of his comments, what we all want is to make sure that everybody can have access to the best possible care. And the question is, how is that best provided? And he has come up with these proposals, and he's done it with himself and his research assistant. So thank you very much, Philip, not just for coming here tonight, but for the work that you have put in stimulating the debate about this. And I think it was Terry that said, you know, we've all got to think about this idea, and if we agree with it, get behind it. Because if we want better hospital provision, then actually we have to do something to ensure that that happens. So thank you very much for the work.
Thank you all for coming this evening. Much appreciated.
Can I just say something, if you don't mind? I represent a group of old people in Bath, in Buckinghamshire.